Top 25 Care Home Nurse UK Interview Questions and Answers. Working as a care home nurse in the UK requires compassion, clinical expertise, and excellent communication skills to ensure the well-being of residents. Employers seek candidates who can deliver high-quality care while maintaining dignity, respect, and professionalism. The following 25 interview questions and answers will help you prepare effectively for your interview by highlighting the skills, knowledge, and empathy needed to succeed in this essential healthcare role. 1. Why do you want to work as a care home nurse in the UK? I am passionate about providing compassionate, person-centered care to elderly residents. Working as a care home nurse in the UK allows me to use my clinical knowledge and interpersonal skills to enhance residents' quality of life. I admire the UK's high standards in elderly care and want to contribute to maintaining those standards. This role also provides opportunities to continuously develop my nursing skills and grow professionally within a supportive environment. 2. What qualities make a good care home nurse? A good care home nurse must be compassionate, patient, and attentive to residents' needs. They should have strong clinical knowledge, communication, and organizational skills to ensure the highest level of care. Empathy and emotional intelligence are vital in understanding residents' physical and emotional conditions. Additionally, reliability, teamwork, and adaptability help maintain a positive care environment and build trust among residents, families, and colleagues. 3. How do you handle a resident who refuses medication? If a resident refuses medication, I first remain calm and respectful, never forcing them. I would assess why they are refusing, whether due to fear, confusion, or side effects, and provide reassurance or explanations as appropriate. If refusal continues, I would document the incident, inform the GP and senior nurse, and follow the care home's protocol to ensure the resident's safety and well-being while respecting their rights. 4. How do you ensure person-centered care? I ensure person-centered care by treating each resident as an individual with unique preferences, needs, and values. I involve them in decision-making about their care and respect their choices. Regular communication with residents and their families helps tailor care plans to meet physical, emotional, and social needs. My goal is to promote independence, dignity, and comfort while fostering a caring and supportive environment. 5. Describe how you deal with a medical emergency in a care home. In a medical emergency, I remain calm and act promptly. I assess the situation, ensure the resident's airway, breathing, and circulation are stable, and call for emergency assistance if needed. I follow the care home's emergency protocol, administer first aid or medication as prescribed, and monitor vital signs. Documentation and communication with the GP, management, and family members are crucial after ensuring the resident's immediate safety. 6. How do you handle conflict with a colleague? If conflict arises, I approach it calmly and professionally, seek and understand the other person's perspective. I focus on resolving the issue through open communication rather than blame. If needed, I involve a supervisor or manager to mediate. Maintaining professionalism and respect ensures teamwork remains strong, and residents continue receiving consistent, high-quality care despite personal differences. 7. How do you maintain accurate care records? I ensure all care documentation is clear, factual, and up-to-date. Every observation, medication administration, and care activity is recorded promptly. I use electronic or paper-based systems accurately, adhering to confidentiality and data protection policies. Accurate record-keeping ensures effective communication between care teams, supports clinical decision-making, and maintains compliance with regulatory standards such as the Care Quality Commission (CQC). 8. How do you deal with a distressed or confused resident? When a resident is distressed or confused, I approach calmly and with empathy. I use a gentle tone, offer reassurance, and identify potential triggers such as pain, fear, or unfamiliar surroundings. Providing comfort, maintaining eye contact, and using familiar objects or routines can help reduce anxiety. If the behavior persists, I inform the senior nurse and update the care plan to address ongoing needs. 9. What experience do you have with dementia care? I have experience supporting residents with varying stages of dementia, focusing on maintaining dignity, safety, and comfort. I use effective communication techniques, such as speaking slowly, using simple words, and offering reassurance. I engage residents in memory-stimulating activities and monitor changes in behavior closely. Understanding dementia's emotional and physical impact allows me to provide compassionate, consistent, and individualized care. 10. How do you prioritize your workload during a busy shift? I prioritize tasks based on urgency and resident needs. For example, administering time-sensitive medication or addressing emergencies comes first, followed by routine care and documentation. Effective time management and delegation are key to maintaining efficiency. I remain flexible to adjust priorities as situations change while ensuring every resident receives safe and consistent care throughout the shift. 11. How do you maintain residents' dignity and privacy? Maintaining dignity and privacy is central to nursing care. I always knock before entering a resident's room, use curtains or screens during personal care, and explain procedures beforehand. I respect residents' choices about their care and encourage independence whenever possible. Treating residents with respect and kindness helps build trust and fosters a supportive, dignified care environment. 12. How do you handle end-of-life care? End-of-life care requires compassion and sensitivity. I focus on providing comfort, pain management, and emotional support for both residents and their families. I work closely with palliative care teams to ensure the residents' wishes are respected. Open communication, empathy, and maintaining dignity are my top priorities, ensuring the resident experiences peace and respect in their final days. 13. What steps do you take to prevent infection in the care home? I follow infection control protocols strictly, including hand hygiene, wearing PPE, and properly disposing of waste. I educate residents and staff on infection prevention measures and maintain a clean environment. I also monitor for signs of infection and report them promptly. Adhering to NHS and CQZ guidelines ensures residents remain safe from avoidable infections and cross-contamination. 14. How do you communicate effectively with families? I maintain open, honest, and empathetic communication with families. I provide updates on residents' health, address concerns promptly, and listen carefully to their input. Building trust and transparency helps families feel involved and reassured. I always maintain confidentiality while ensuring that the family's perspective is respected and integrated into the resident's care plan. 15. How do you handle medication error? If I make or discover medication error, I immediately ensure the resident's safety by assessing their condition and notifying a senior nurse or GP. I document the error accurately, complete an incident report, and follow the care home's policy. I then reflect on the cause to prevent recurrence, emphasizing learning and accountability rather than blame. 16. What do you understand about CQC regulations? The Care Quality Commission, CQC, regulates health and social care services in the UK. It ensures care homes meet standards of safety, effectiveness, compassion, and quality. As a nurse, I follow these regulations daily through proper documentation, infection control, medication safety, and respectful care. Meeting CQZ standards promotes transparency, accountability, and continuous improvement in the care home environment. 17. How do you support residents' mental health and well-being? Supporting mental health is as important as physical care. I engage residents in social activities, encourage open communication, and monitor for signs of depression or anxiety. Providing a sense of purpose, companionship, and emotional support helps enhance well-being. Collaboration with mental health professionals ensures residents receive appropriate interventions and maintain a positive, fulfilling daily life. 18. How do you handle a complaint from a resident or family member? I listen calmly, thank them for bringing up the issue, and ensure their concern is taken seriously. I investigate the matter promptly, keeping communication transparent. If the issue can't be resolved immediately, I escalate it to management. My goal is to resolve complaints respectfully and efficiently, while learning from feedback to improve future care delivery. 19. What do you do if you suspect abuse or neglect? If I suspect abuse or neglect, I act immediately by ensuring the resident's safety and reporting it to the safeguarding officer or manager. I document observations factually without confrontation and follow safeguarding procedures as per the local authority and CQZ guidelines. Protecting residents from harm is my legal and ethical responsibility as a nurse. 20. How do you stay up to date with nursing best practices? I stay updated by attending training sessions, reading professional journals, and participating in continuing professional development (CPD) courses. I also engage in peer discussions and follow NHS updates and NICE guidelines. Keeping current with evolving standards ensures I provide evidence-based, safe, and effective care aligned with professional nursing standards in the UK. 21. How do you manage stress during demanding shifts? I manage stress by staying organized, prioritizing tasks, and taking short breaks when possible. Maintaining open communication with colleagues and supporting each other helps reduce tension. Outside work, I engage in relaxation activities and self-care. A balanced approach allows me to maintain focus, provide compassionate care, and protect my mental well-being during challenging situations. 22. Describe a time when you went above and beyond for a resident. Once, I noticed a resident becoming withdrawn after losing a close friend. I took time to engage her in reminiscence activities and encourage participation in group sessions. Over time, her mood improved significantly. Going beyond routine care to address emotional well-being reaffirmed my belief in holistic nursing, caring not just for physical health, but also for the heart and mind. 23. How do you support teamwork in a care home? I believe teamwork is essential for high-quality care. I communicate openly, share knowledge, and offer help when colleagues are overwhelmed. Regular handovers and team meetings foster collaboration and consistency. Respecting everyone's role ensures harmony and efficiency. Together, we create a supportive environment where residents receive the best possible care. 24. How do you ensure medication safety? I follow the 5 rights of medication administration: right patient, right drug, right dose, right route, and right time. I double-check labels, avoid distractions, and maintain accurate records. I store medication securely and report any discrepancies immediately. Vigilance and adherence to protocols ensure residents' safety and compliance with CQC and NMC standards. 25. What motivates you in nursing? My motivation comes from making a positive impact on residents' lives daily. Seeing them comfortable, happy, and well cared for brings great satisfaction. Nursing is more than a job. It's a calling rooted in compassion and dedication. Every day offers new opportunities to learn, grow, and provide meaningful care that uplifts others. Preparing for a care home nurse interview in the UK requires a blend of clinical confidence, compassion, and professionalism. By understanding these common questions and crafting thoughtful responses, you can demonstrate your readiness to provide excellent care while upholding the values of dignity and respect. With empathy, teamwork, and dedication, you can make a meaningful difference in residents' lives and excel in this rewarding nursing career.